Appreciate everybody being here. Today I'd like to provide an update to the American people on several decisive new actions we're taking in our very vigilant effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible. A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago. So that was lucky, or through talent, or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe, will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time. They were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and inside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York. The emergency orders I'm issuing today will also confer broad new authority to the Secretary of Health and Human Services. The Secretary of HHS will be able to immediately waive provisions of applicable law to vastly increase and accelerate our capacity to test for the coronavirus. We want to make sure that those who need a test can get a test very safely, quickly, and conveniently, but we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms. Using federal emergency authorities, the FDA approved a new test for the virus. We did this within hours after receiving the application from Roche, a process that would normally take weeks. We therefore expect up to 500,000 additional tests will be available early next week. We'll be announcing locations probably on Sunday night. I want to thank Roche, great company, for their incredible work. I'd also like to thank Thermo Fisher. The FDA's goal is to hopefully authorize the application within 24 hours. It'll go very quickly. It's going very quickly, which will bring additionally 1.4 million tests on board next week and 5 million within a month. I doubt we'll need anywhere near that.
Can meet the needs of the American public. We are grateful to LabCorp and Quest for taking up the charge immediately after the meeting, and within 72 hours bringing additional testing access, particularly to the outbreak areas of Washington State and California, and now across the country. We are also very grateful to the universities and large hospital systems that took up the charge to develop their own quality tests, made available by new FDA guidance. This has resulted in expanded testing across New York, California, Washington, Colorado, and you see sometimes those drive-through options that have been made available through these high-throughput options. Following the meeting last week, major commercial laboratory equipment and diagnostic companies took immediate action to adopt and develop new testing systems. Last night, the initial company, Roche, received FDA approval, moving from request to development to approval in record time. This innovative approach centered fully on unleashing the power of the private sector, focusing on providing
I think everybody out here knows you pretty well, but Tony has been doing a tremendous job working long, long hours, and you've seen a lot happen, but this has been, it's been a great experience, and working with you has been terrific. Tony, please.
Thank you very much, Mr. President. This is an example of another example of what I've been referring to in my discussions with many of you in the audience as a proactive, leaning forward, aggressive, trying to stay ahead of the curve. And what you're seeing now with this order is that we're going to be able to remove the constraints so that people at the state, the local level, the individual physician, all the way up through the federal government will have as many constraints as possible removed for them to
Brian Cornell, Target. Thank you, Brian. Thank you, please.
Well, Mr. President, thank you for inviting us here today, along with our colleagues from Walmart and Walgreens and our partners at CVS. Normally, you'd view us as competitors, but today we're focused on a common competitor, and that's defeating the spread of the coronavirus. And we look forward to working with the administration to do our fair share to alleviate this growing threat. So thank you for including us today. In the near term, we're all committed to making sure we're keeping our stores open to serve the American consumer who's rapidly stocking up on household essentials, key food and beverage items that they need during this time, making sure we run safe stores and create an environment that's safe for our team members, making sure that they feel supported during this very critical time. So thank you for including us.
Thank you very much. Great job. Is Tom here? Tom Poland? Thank you very much. And we'll be changing a lot of the rules, regulations for future, should this happen in the future, which we hope it never does, but it will, I guess, somewhere out there. There's some bad ones over the years, and I guess that'll continue to an extent, but we hope it never happens. But we're going to be changing a lot of the old rules and specifications and regulations. Adam Schechter, who's really been of tremendous help, LabCorp, please. Adam.
Thank you, Mr. President. At LabCorp, we're working every second of every day to increase the number of tests that we can run. We're working with academic medical centers, with our colleagues at Quest, with other hospital and other laboratories to ensure that we do everything we can to increase the testing as we move forward. And I can tell you, we understand how important the testing is, and we are committed to doing everything possible.
Thank you.
from early on, not only are we bringing a whole-of-government approach to confronting the coronavirus, we're bringing an all-of-America approach. Mr. President, from early on, you took decisive action. You suspended all travel from China. You created travel advisories, South Korea and Italy. We screened all travelers from all airports in both of those countries. And on the unanimous recommendation of your health experts, you, at midnight tonight, will effectively suspend all travel from Europe, and Americans that were returning will be screened and asked to voluntarily participate in a 14-day quarantine. Throughout this process, Mr. President, you've put the health of America first, but you brought the best of America to address it. And it's not just at the federal level. As you said, Mr. President, we've been working with states across the country. We issued broad guidelines from CDC for every American. Will articulate about visitations at nursing homes. It's important to remember that they were there for us when we were growing up, Mr. President. They helped us with our homework. They tucked us in at night. They cheered us on as we pursued education, cheered us on in our careers, and now it's time for us to be there for them and to recognize that seniors with chronic health conditions are the most vulnerable, and Americans can make a difference. So wash your hands, use common sense, look after the most vulnerable. And Mr. President, I know I join you in saying that every American should be proud of this incredible public-private partnership that's going to be speeding access of testing to millions of Americans in the weeks ahead. And together, as you've said many times, together we'll get through this. Together we'll put the health of America first.
Thank you. Thank you very much. Seba, where's Seba? I'd like you to maybe take that a step further, please, on nursing homes? Thanks. The great sports that we've gotten so used to at this time of the year, they're not going to be meeting, and they've done a great service, actually, but that would be another way that it could be, problems could be caused. But this is why I outlined on Wednesday night my administration's the fact that we've issued a requirement suspending all medically unnecessary visits to various places, but in particular nursing homes. We should all be working off the same playbook when it comes to protecting Americans. We have to. We need to be consistent in adopting measures to limit the spread of the virus. The virus is the same whether it's spreading in cities, towns, or rural communities. The tools and tactics for attacking it are similar no matter where you go. No matter where you go, you have some hot spots throughout the world right now that people would have never thought possible. And they're being very seriously affected. Key among these efforts are breaking chains of transmission between people. These measures have been adopted by many companies, universities, and schools. And we want to protect the safety and the health of their employees and their students. I encourage everyone to follow the guidelines we've issued by CDC and these common sense measures. A lot of it's common sense. For the areas where the virus is spreading, the CDC is advising communities to postpone large gatherings, postpone assemblies, social functions, and sporting events, stagger recess and lunch for schools that aren't canceled.
You were opposed to it. What has happened since then, and what's the holdup on that?
Well, we just don't think they're giving enough. We don't think the Democrats are giving enough. We're negotiating. We thought we had something, but all of a sudden they didn't agree to certain things that they agreed to. So we could have something, but we don't think they're giving enough. They're not doing what's right for the country.
And if I could ask Dr. Fauci?
Go ahead, please.
Thank you, Mr. President. You just mentioned waiving interest for student loans.
Yeah.
You talked about buying oil from the SPR or adding to the SPR. What other specific targeted measures is your administration thinking about taking? The Treasury Secretary, Steve Mnuchin, said today that you're just in the second inning of things that you might be undergoing.
That's true. And we are looking at many different things, as you know. You know some of them. They've been written about very widely. But we're going to be releasing a paper in about 2 hours stating quite a few other steps, very important ones. Please, go ahead.
What, sir, if you wouldn't mind?
Please, go ahead.
Thank you so much, Mr. President. I want to know if you are in contact with the Brazilian President Bolsonaro after a member of his
because she can't do it without it. So when I said that, I meant the system was not designed for what we need. Now, looking forward, the system will take care of it.
Mr. President,
And
with respect,
interestingly, if you go back, please, if you go back to the swine flu, it was nothing like this. They didn't do testing like this, and actually they lost approximately 14,000 people, and they didn't do the testing. They started thinking about testing when it was far too late. What we've done, and one of the reasons I think people are respecting what we've done it very early. We've gotten it very early, and we've also kept a lot of people out.
Mr. President,
yes,
the
please, go
last
ahead.
administration
Please.
said that they had tested 1 million people at this point. You've been
Well, ask them
president
how
for
they did with the
3
swine
years.
flu. It was a disaster.
But with respect, you've been
Next,
president
please.
for 3 years,
Next,
and
please.
Wuhan was suffering.
They had a very big failure with swine flu, a very big failure.
President, I want to ask you about the European travel ban that goes into effect at midnight tonight and the exemption that you've offered
Go ahead, please. If you have any questions for these great geniuses up here, you should, even a business question related to what we're talking about.
Mr. President, Ross Palumbo from ABC News Miami. As a relatively new Floridian, what is your message today to the cruise line industry and the travel industry that Florida depends upon? And since Senator Rick Scott and Miami-Dade Mayor Carlos Jimenez have the same exposure as you and they are self-isolating, what's your message to them that they shouldn't be?
Well, I don't know that I had exposure, but I don't have any of the symptoms. And we do have a White House doctor, and I should say many White House doctors, frankly. And I asked them that same question, and they said, you don't have any symptoms whatsoever. And we don't want people without symptoms to go and do the test. The test is not insignificant. As far as the cruise line business, we're with them all the way. It's a great business. It's a great U.S. business, frankly. And I know how important they are to the country. That includes airlines, but the cruise line business obviously was hit very hard. We had a tremendous success out in
Outbreak will peak? How long will the American people have to remain on this emergency footing? And for Dr. Birx, as the administration tries to get its arms around this test kit shortage issue, the next glaring need could be respirators and related hospital equipment. So what is the administration doing right now to ramp up production of respirators and that kind of equipment should this outbreak persist?
So when you have an outbreak like this, particularly if you're trying to interfere with it, it's really impossible to predict the time element of when it's going to peak and when it's naturally going to go down. So if you look at the situation where countries really did not get to the point of trying to contain and mitigate very well, you see a peak over several weeks and then down again over other several weeks. What we're trying to do with the efforts that we're doing is to blunt that peak. And I mentioned it many times, and I think it's important and appropriate
very much, Mr. President. In your speech to the nation, you mentioned the situation in China and South Korea have improved, and you're thinking about remove the restrictions, also the warning
Right.
in place right now. When can we expect that announcement, and how do you see the overall progress that Asian countries made?
Well, some are making progress, some are not, as you know, but some are making progress. And as they make progress, as they get down to the number that we all think is right, that they know is right, we know is right, we'll be opening it up. And some are really moving along rapidly. We hope to be able to open things up as quickly as possible. Go ahead, please. Go ahead.
Mr. President. I'd like to ask Secretary Azar and Dr. Fauci just how Dr. Fauci, okay?
Right, it better,
all right.
it better. Not 100%, but 90%.
Right.
Go ahead.
This affects the elderly primarily, and in that sense, it's an unusual disease. Is any specific research being done as to why
that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know about the reorganization that happened at the National Security Council.
It's the administration. Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
But this was
Please go ahead. We're doing a great job. Let me tell you, these professionals behind me and these great, incredible doctors and business people, the best in the world, and I can say that.
Europe to self-quarantine for a couple weeks. You were in a picture with somebody who now has coronavirus from Brazil at Mar-a-Lago. How is that different?
Well, I'll tell you, first of all, I'm not coming back from someplace.
But you were exposed.
There was somebody that they say has it. I have no idea who he is, but I take pictures and it lasts for literally seconds. I don't know the gentleman that we're talking about. I have no idea who he is. I haven't seen the picture. I said there's a picture of somebody, but I take sometimes hundreds of pictures a day. And that night I was taking hundreds of pictures, so I just don't know. Now, I did sit with the president for probably 2 hours, but he's tested negative, so that's good.
It's just a matter
Please
of...
go ahead.
And the domestic travel, sir?
Go ahead, please. I would say if you stay home, it's not bad. It's not bad. Now, there are certain parts of the country that are essentially have zero problem. Washington's been very tough, in particular a nursing home. But Washington...
Well, as the President said, and Dr. Fauci has articulated, the nature of our current system where the CDC has samples sent and tests are performed, or state labs perform tests, or in some cases university and hospital labs perform tests, is generally adequate for an infectious disease or for people getting a diagnostic work done. But given the sheer scale of this, the President tasked us with bringing together this extraordinary public and private partnership. Today, by some estimates, when you add all the labs together, and today the President made it possible for every state in the country and their state labs to authorize labs across their state to do coronavirus testing. We're estimating somewhere between 15 and 20,000 tests a day are able to be performed. But very soon, with the program that was announced today, Americans will be able to visit one of the sites closest to them, as described on the website, if they're symptomatic, if the questionnaire indicates it.
pests take 6 months or more to develop. So we're not waiting for those. We're still diagnosing this on nucleic acid. So it's an antibody. This is actually the antigen, the actual virus in your nose that we're amplifying.
I think you have to remember, though, we're working very closely with states, and so you have a smaller form and more targeted form of government going in and doing it, like in New York, where the relationship is very good, like Gavin Newsom, where he made some very complimentary, that's California, he made some really complimentary comments the other day about how we're working together. We worked on the ship together, but we worked on a lot of other things together having to do with this. And we're really, the relationship that we have, I can't think of a bad relationship. We're helping them. We're funding them in some cases, depending on what it is you're talking about. And we're all working together very closely. So we've done really, I think, a tremendous job of teamwork with the different states. All right, one or two more. And if you have questions for these folks, does anybody have a question for the folks up here? Who has a question up here? You have? Okay, go ahead. If you have a question, go ahead.
Thank you. I have one for you as well.
I thought. I know
no, but I do have one for them because I haven't heard this
I was waiting
yet.
for that. Go ahead.
Because I haven't heard this yet.
Ask them first, please.
Yes, I will. Okay, with regards to the CEOs, can you please tell us when you expect to see items like hand sanitizer that have been going out of stock very quickly back on the shelves? There have been a lot of reports about that. And for you, Mr. President, could you talk about a potential bailout for the cruise industry? You had suggested that could happen. Is that something you're still looking at, and how much would that be?
Well, I didn't suggest that it could happen, but I can tell you it's an industry that was very badly impacted by what's going on with the virus. And it's a great industry. It's a very important industry, and we will be helping them, and we will be helping the airline industry if we have to, assuming we have to. So far, people haven't been asking, but if they should be asking, we want to make sure our airline is very strong. And then one day, all of a sudden, wasn't looking so good. Interestingly, I was talking to Doug, and the numbers they're doing from the retailing standpoint, I guess because of this, your business is like the opposite. All of you you've been selling a lot of stuff. Do you want to answer the question as to the hand sanitizers?
Sure. Yeah, specifically, the areas where we're seeing pressure in the supply chain are surface cleaners, cleaning supplies, paper goods in particular. Hand sanitizer is going to be very difficult to have 100% in stock on for some time. We're still replenishing it and shipping it, but as soon as it hits the stores, it's going. The same thing's true for the categories I just mentioned. So all the retailers will be working hand in hand with the suppliers to bring that to the market as fast as we can.
What is your advice, though, for Americans who are seeking those items? What is your advice? They're selling out online. They're selling out in the stores.
I think this team has given you other examples of what people can do to fight back against this virus, and you should look at the entire list.
Please.
As often as you possibly can. And I know you're not always in a position to be able to wash your hands, but wash them as much as you can. If you don't have the alcohol wipes, try and get them. If you can't get them, just try as best as possible to do it. I mean, you got to do the best you can.
Well, just general preparedness. You know, you want to wash your hands. You want to keep distance from people. And if you're around someone sick, keep away from them. This is basic public health. Now, these guys are selling a lot of toilet paper. I don't know. There seems to, Tony, did you need to give some guidance that toilet paper is not an effective protection against getting the coronavirus? They're selling out. But the soap and water, hot water, soap, 20 seconds. That's how you do it.
Okay, one more. Go ahead. Go ahead. No, over here, behind you. Behind you.
Thank you very much, Mr. President. You have a great team, of course.
That's true.
My question is, Mr. President, are you happy from the Chinese response? What correctly really told you what really happened those days? And second, Prime Minister Modi or India have closed borders until April 15th, if you have spoken with the Prime Minister of India and if they have needed any help. And finally, sir, any message for the small businesses because they are losing some businesses because of this? Thank you, sir.
Well, on small businesses, the Small Business Administration is now stacked with money to help them, and we're going to make the money readily available if they need it, small businesses. We had a great time in India. It was an incredible 2 days, and he's a great friend of mine, and he's a friend of his people, because he was greeted incredibly warmly, as was I, in that stadium. It was an incredible event, and I loved being with him. So just say hello to him. But we talked about everything. We talked about far more than just borders. And as far as President Xi, likewise, he's a friend of mine. I believe that we are dealing in good faith, that we just worked as you know, and as I just said, we just worked an incredible deal, big deal, one of the biggest deals ever made of any kind. Big even by the standards of some of the people here, the deal with China. But I think that they want to get to the bottom of things also. We're working, our drug companies, our pharmaceutical companies are working very closely with China and with India, as you know, and with all over the world. And they're all over the world. These are magnificent companies that are very, very knowledgeable. And we're very lucky to have them, because I think you're going to come up with, whether it's therapeutic or whether it's just help in getting better, and then ultimately a vaccine, which takes a little bit longer because of the test periods and a couple of other reasons. You're going to have it very quickly because of the great knowledge, and they'll have it very quickly. They've made a tremendous amount of progress. Thank you all very much. We appreciate it. Thank you. Thank you very much.
Cases go down to zero, Mr. President. You said the cases would go down to zero. Can you explain why that didn't happen?
President Trump at the White House declaring a national state of emergency over the coronavirus pandemic, which has spread to more than 120 countries. Senate Minority Leader Chuck Schumer